Hi, I'm Sadie Webb, and this is my head-to-toe assessment for the RN to BSN program. And today we're doing the assessment at home, so it's not exactly the same environment as if we were in a clinic or office with an examination table, and also kind of explaining some of the differences as we go through. What makes it more challenging to do the assessment this way? Before I come in, I'm going to wash my hands. I'm going to make sure my equipment is clean and ready to go. And I'm going to start out by introducing myself. Hi, I'm Sandy. I'm going to be doing an examination on you today. How are you?
I'm good.
Good. Any concerns that you have?
No.
Okay. I'm going to start out and try to tell you as I'm going what we're going to be doing and go through just the body systems. If you have any questions or anything, just stop me and let me know. I want to ask you first of all if you'll tell me your full name and where you are and what the date is.
Anthony Parton, and it's the 5th of December, 2012, and we're in the hospital. Something like a hospital, I guess.
Okay.
That's where we're supposed to be anyway.
Okay.
We're in a house, but...
Okay. All right, and so Mr. Herman, he's alert and oriented. As we do the assessment, I'll keep checking this and making sure that he stays alert and oriented as we go through. One of the first things I'm going to do is do an overall assessment of the skin, and skin looks pink, not pale or flushed or anything along those lines. I'm also going to check the temperature of the skin. I'm checking on his arms, and skin's warm and dry. And also I'm going to look at the legs as we go as well. Again, skin's warm and dry, no lesions, anything along those lines. So we're looking good there. Then I'm going to move to check the eyes, and 2 flashlights laying here, sorry. I'm going to ask you to look forward. I'm going to be shining a light in your eyes just to check your pupil response. So if you look at the picture there on the wall, I'm going to shine a light here on you. Okay. Okay, perfect. And now I'm going to hold my finger up here. I'm going to look at the picture on the wall, and now look at my finger. Okay, good. I'm watching the pupils for to make sure the pupils are equal around, reactive to light, and accommodation, and they are. I'm now going to check the mucous membranes, and so I'm going to ask you to open your mouth and stick your tongue up for me. Okay, good. Can you say ah? Okay. And look here. Good. Everything looks pink, dry, no, or not dry, I'm sorry, pink and moist, no lesions or anything there. Okay. I'm going to do the assessment on the ears. I do not have an otoscope, so I'm going to go ahead and just talk through what I would do if I had one. So I'm going to take the ear and pull up and back and insert the otoscope, and we'll be pointing towards the nostril, and you're looking at the tympanic membrane, and you want it to be a pearly gray. It's going to reflect the light from the otoscope on it. Looking also at the external ear canal for make sure you have no redness or lesions or any exudate from the ears. Again, because the situation's kind of hard to get to, but I would do the same thing on the other ear and make sure that everything looked fine in that ear. I'm now going to go ahead and do as we work down the system, go ahead and do the cardiac assessment. So I'm going to listen initially at the second intercostal space. I'm going to listen on the right side of the sternal border. And I'm going to move to the left side, the second intercostal space. And we'll go to the third intercostal space, the fourth, and the fifth. I'm going to listen to the apical pulse for 1 full minute. and that rate was 71. Heart tones were regular, and I didn't hear any extra heart sounds, no murmurs or anything along those lines. I would listen also with the bell of my stethoscope to make sure that I didn't hear any of those extra sounds, but everything there appears normal. I'm going to ask you to sit up, and I'm going to listen to your lungs there. Start here interiorly. Deep breath in. Good. Okay, I'm going to listen posteriorly as well. Taking some deep breaths. I'm asking you to lean back there for me again. Thanks, everything sounded good. Breath sounds were even and regular. And,
Trying to steal your flashlight.
I'll need it again in a second. We're even and regular. Also, I'm going to check for the thorax, kind of assess there. For again, the patient would be in a gown, so I'd be looking at the skin. And also, when I was listening to the lungs posteriorly, would be looking at the skin on the back. Sometimes people may have lesions or things that they're not even aware of, and so definitely want to be on the lookout for skin cancers and things like that. But I'm going to look for symmetry of the thorax, and so what I'm going to do in that was ask him to take a deep breath. Good. Thumbs move part equally. Do one more for me. Good. So want to make sure that everything looks okay. The AP ratio looks good. It's a 1 to 2. Next, I'm going to move to the abdominal assessment. Pull your shirt up here just a second, if that's okay. And you want to look initially for any irregularities in the skin, or any pulsations or anything along those lines that would be obvious, and I don't see anything. I'm also going to stoop, shine a line across, and make sure everything looks okay. Again, no pulsations or anything I would have missed standing and looking from above. I'm also going to check bowel sounds in all 4 quadrants. Okay. Bowel sounds are present in all 4 quadrants. Not hypo or hyperactive, they're just normal. And I'm going to also do some palpation. Tell me if you have any tenderness or any soreness. Okay. Everything there looks good. The next thing I'm going to do is look at the, sorry, my words are going away. I'm going to check lymph nodes. And so you can go ahead and have your one up there for me just a little bit. Good? Okay. I'm going to start here with the preauricular. You're going to use your 3 middle fingers. There. You're looking to make sure that they're equal and they're movable. And they're not, you don't want to have them enlarged. Also, any tenderness should be noted. Any tenderness? Okay. All right. I'm also going to check the axillary lymph nodes. So let's get raise your arm here. Sorry, are you ticklish?
Yeah.
Okay, sorry. This is not going to be so fun. Let me know if you have any tender spots, okay? It's always challenging when you have a ticklish patient. No tenderness there?
No.
Okay, and I would do the same thing again because of reach. I'm not going to do that, but we'll do the same thing on the other side as well. Next, in going with a peripheral vascular assessment, I'm going to look at a couple of things with pulses and that kind of thing. So I'm going to check radial pulses here. Good, both good +2, good strong pulses. I ask you to squeeze my fingers as well. Good strong grips. I also want to look at the patient's capillary refill. Unlike me, he doesn't have retinol polish on. It's good, less than 3 seconds. I'm then going to move to the legs. Because I've already kind of assessed the skin here for temperature and making sure we don't have any irregularities there. But I now want to look at the pulses. I want to go to check the DP pulses. And then checking the posterior tibial pulses. And those are good and strong, a good +2. I also want to check for any edema. No edema present. I also want to ask you to push your feet against my hands here. Good, good strong plantar flexion reflex there. Now that I think I've completed the peripheral vascular assessment, I'm going to go ahead and have you stand and do the musculoskeletal assessment as well. And while I've got you standing, I'm also going to check for the way we did posteriorly for thoracic symmetry here. So again, put me thumbs together, take a deep breath for me. Thumbs come apart, do that again. Good. Good symmetrical movement there. In looking at the spine, you want to check, look, everything appears to be straight, no curvatures. Any tenderness or soreness in your back or spine?
No.
Look at the musculature too. Okay, let's get a bend over and look at the curvature of your spine that way. Okay, spine looks good and straight. The curvature looks even. Okay, all right, thank you. And I believe this concludes my head to toe assessment. Thank you.